Welcome back friends. Today in this video tutorial of Anita Bioconcept once again, and I am with you all here to discuss on the topic thyroid disease and hyperthyroidism. In thyroid disease I will discuss about hyperthyroidism. Okay, so it is the condition when too much thyroid hormone is produced and released, secreted by the thyroid hormone, and its metabolic processes are being speeded up. Okay, speeded up. Now we will see that what are the various causes, reasons as well as conditions which result in hyperthyroidism, what are their signs and symptoms. Okay, what are their causes, what are their signs and symptoms, followed by their diagnosis. Okay, because unless and until it will not be diagnosed, it won't be treated. Okay, so diagnosis, about their treatment options, So about all these points I will be discussing. So let's start with the causes. What are the probable causes, or what are the probable conditions that are being responsible to give rise to hyperthyroidism condition? So the first cause is nodule formation. Okay, formation of nodule. Okay, so in case of hyperthyroidism, it can occur due to nodule that are overreactive, okay, and they are overreactive within the thyroid. So there are two conditions of the occurrence of these nodules. Okay, so these nodules can be single. There can be a single nodule. It can be single in number, or it can be more in number. Okay, it can be several nodules can be present within the thyroid gland, and then this gland is known as toxic multinodular gland. Toxic multinodular gland. And when it is single in number, when this nodule is single, then it is known as toxic autonomously functioning thyroid gland. Then the thyroid gland will be known as toxic autonomously functioning thyroid gland. And when there will be multi nodule, then when there will be many nodules within the thyroid glands, then this gland will be known as toxic multinodular gland. Okay, so these are the two conditions, when the nodule will be single in number and when the nodules will be several in number within the thyroid gland. Now the second condition I'll talk about. The second condition is excessive iodine. Okay, excessive iodine. Much more iodine makes much more hormone. Okay, because thyroid gland makes hormone. So if there will be much more iodine, if there will be excessive iodine, then the thyroid gland is going to make much more hormone than the requirement, than it needs. Okay, so this condition also results in hyperthyroidism. Okay, now the third condition we will talk about. The third condition is Graves' disease. Okay, Graves' disease. Okay, in this Graves' disease, what happens? Entire thyroid gland is overreactive. Entire thyroid gland becomes overreactive, means it produces too much of hormone. Hormone production is increased too much. Okay, so this condition is Graves' disease, and this problem is called as diffuse toxic. This problem is known as diffuse toxic goiter, also known as also known as enlarged thyroid gland. Enlarged thyroid gland. So these are the three probable causes or three probable conditions which does result in hyperthyroidism. So what are those? Nodule formation, then after excessive iodine, and after that Graves' disease. Okay, so now let me tell you about the sign and symptoms followed by diagnosis. About the sign and symptoms. Sign and symptoms. Sign and symptoms. Okay, sign and symptoms, and about the diagnosis, right? So what are the sign and symptoms? Okay, anxiety is there, okay, feeling nervousness, feeling that memory is becoming so, anxiety, okay, feeling nervousness, sometimes feeling nervous, okay, improper sleep, patient is not able to sleep properly, improper sleep, okay. Then after weight loss is there, muscles become very weak, okay, weak muscles, okay, patient becomes sensitive to heat, sensitivity to heat increases. And one more conditions has been observed, that the goiter, or we can say that thyroid gland becomes enlarged, okay, enlarged thyroid gland. So all these signs and symptoms are of hyperthyroidism condition. Now let me tell about the diagnosis, how this hyperthyroidism abnormality is being diagnosed. Okay, so after looking the sign and symptoms, because whenever a patient goes to doctor, the doctor asks for the family history of the patients, and then after he or she also inquires about the sign and symptoms the patient is having, and also enlarged thyroid gland is being observed, and doctor recommends for the blood test. So diagnosis is by blood test. Okay, now in blood test what happens? TSH is being examined, the amount of TSH is examined. Okay, in condition of hyperthyroidism what happens? The body senses high level of thyroid hormone, body senses high level of thyroid hormone, because it is the condition of hyperthyroidism. So hyperthyroidism means the thyroid gland is secreting, it's producing much more thyroid hormone. So obviously in the patient's blood, in the body's blood, the thyroid hormone will be observed in very high amount, okay, high amount. So body senses high level of thyroid hormone, so thyroid hormone level will be very high, okay, and then after the body will stop releasing TSH, thyroid stimulating hormone will be stopped, the release of this hormone by the pituitary gland will be stopped, because already in the body there is thyroid hormone which is in high level. Okay, so this will be the diagnosis after the blood test. This is the diagnosis of thyroid disease. Now come to its treatment option. Treatment option. In its treatment options, the first treatment option is actually it is one of the option beta blockers. Beta blockers are being used, beta blockers treatment is used. And what is the meaning of beta blockers? This beta blocker treatment is recommended by the doctors, and beta blockers what it does, it stops some of the effect of thyroid hormone, and immediately reduces, very quickly it reduces the sign and symptoms, some of the sign and symptoms such as rapid pulse rate. Okay, I have forgotten to tell it about it in the sign and symptoms. Pulse rate is rapid. Okay, so in this beta blocker treatment, what happens? Beta blockers stop the effect of thyroid gland, and it quickly reduces the sign and symptoms, including rapid pulse rate. Okay, and then after come to second treatment option. Some more treatment options are there. For example, anti-thyroid drugs are being used. Anti-thyroid drugs are being, and what they do, they just stop the thyroid to make much more hormone, because they are anti in action. So these anti-thyroid drugs are going to stop the gland or thyroid gland to stop the synthesis of hormone, So this is the this is the function of anti-thyroid drugs. Okay, now I will discuss about the third treatment option, and what is that? That is radioactive. Okay, I will have to rub it. There is no space. Okay, so the first treatment option is the use of beta blockers, and the second treatment option is anti-thyroid drugs, and the third treatment option is to use radioactive iodine tablets. Okay, so the cells absorb tablets. Okay, so the cells absorb iodine. We know that the cells absorb iodine. So these tablets. So what these tablets will do? So what these tablets are going to do? We know that the cells absorb iodine. Okay, so these tablets destroy them. So these tablets destroy them, and overproduction of hormone can be stopped. Overproduction, because in case of hyperthyroidism there is overproduction of hormone. So overproduction of hormone will be stopped by the use of radioactive iodine tablets. The last treatment option, and the one more treatment option, is through surgery. Okay, and surgery is done by the help of which some part or all of the thyroid is removed. In surgery there are two options: some part of the thyroid, or all of the thyroid will be removed. Okay, so in case of using radioactive iodine tablets and in case of surgery, so both these treatment options can result in hypothyroidism, in which the patient will have to take the thyroid replacement therapy, because there will be no secretion, or there will be very less secretion of the thyroid hormone. So just by following these two options, radioactive iodine tablet, if the patient is following, or if the patient is treating, if the patient is being advised to take, and if the patient has followed the radioactive iodine tablets, and if the patient has undergone surgery, then after these two conditions, person no longer produce hormone and they can suffer the hypothyroidism. In this condition, they will require the thyroid hormone replacement treatment, thyroid hormone replacement therapy or treatment. So this is all about the hyperthyroidism disease, in which the secretion, in which the production of hormone, or there is overproduction of thyroid hormone takes place, and it can result in many problems, resulting anxiety, nervousness, improper sleep, weight loss, weak muscles, sensitivity to heat, goiter, enlarged thyroid gland, and pulse rate also becomes very rapid. So I have explained here about the signs and symptoms, diagnosis along with the treatment. So with this all, thank you.